A new effort is underway to help reduce the number of overdoses in Chicago by distributing fentanyl test strips. Now, 87% of fatal overdoses in Cook County this year are related to fentanyl, which is a highly addictive synthetic opioid. The city's public health department is distributing these test strips to try and reduce the number of deaths from the drug. And joining us now with more are Dr. Wilnese Jasmine, Medical Director of Behavioral Health with the Chicago Department of Public Health, and Jeff That McDaniel, HIV tester and Narcan specialist with the Chicago Recovery Alliance. Thank you both for being here. First, Dr. Jasmine, what prompted the city to start using these fentanyl test strips?
Yeah, to add a little bit more context to it, as a result of the reports that were released that showed that there were increased number of opioid overdose deaths during 2020, the CDC, they also announced that federal funding, mainly the grants they send out to the different jurisdictions, can also be used to purchase fentanyl test strips. And so as a health department, we decided to move ahead to purchase them because they're an effective evidence-based harm reduction tool.
And how many has the city distributed so far, and how do they work?
Yeah, so far, since the end of October, we've been able to distribute about 1,400 to 1,500 kits. And the way they work is they only require a small amount of the substance that's about to be used to be dissolved in a liquid. So we provide sterile water, the actual small container. So we're actually using small ketchup cups, a stirrer, something to stir it with, and then you place the strip in to test the substance, and you wait about 1 or 2 minutes for a result.
And Jeff, how crucial have these test strips been from what you've seen on the ground?
Well, from the ground, working out there with individuals, they have been a life changer. At my site today, I saw 42 people, and out of the 42 people, 38 people knew what fentanyl test strips was and that they wanted it. It's giving them that freedom to use the drugs comfortably and safely, to know that they're able to test their drugs and have the options to know if it's fentanyl on there, that they know they can use the drugs, use less of the drugs, or use the drugs with Narcan as well. So it's been very crucial.
We're talking about opioids. There's been, for years and years and years, a rash of heroin laced with fentanyl. Jeff, what about the argument that the city and groups should be discouraging any kind of opioid use, and this might be encouraging the use, even though it's encouraging a safer use by testing whether there's fentanyl in there?
I'm going to say this, sir. This problem is not going to go away. You know what I mean? It's not going to go away. So do we want more death toll numbers to continue to rise? Or do we want to give people fentanyl to test their drugs and be able to use their drugs safely and controllably? I say people who oppose to it, you have to look at the broad picture. If we don't, our death toll numbers are going to keep rising with this overdose. You know, we already close to 600 overdose already, and fentanyl has contributed to 82% of that already with the overdose. So these test strips with the Narcan are life changer. They're changing the whole game in the overdose, and it's a beautiful thing. I applaud the CDC for this.
Right. Okay. Let's talk about the overdose deaths. As we mentioned, in 2020, there were 1,844, a slight dip in 2021, 1,383, although still some pending cases. Dr. Jasmine, is this a measurable drop this year and a positive sign overall?
Anytime we see a decrease in number of deaths, we always see it as a positive sign. And so the whole concept of harm reduction is to remove barriers that are in place that can lead to death. So anytime we can save a life, either through making sure people have the tools they need to test the drug before they use it, or to have the drug reversal medication, Narcan, available, we consider that a win. But in addition, by giving the fentanyl test kits away, we're hoping to start this conversation, not only with the harm reduction outreach organizations, but also in substance use services and healthcare providers, that they are also screening individuals specifically for fentanyl.
And as we mentioned, the vast majority of opioid deaths come as a result of fentanyl. Why is that, Dr. Jasmine? Why such an overwhelming amount of deaths due to fentanyl? Is there more fentanyl in opioids this year over years past?
Yeah. Since we began tracking the components of the drugs that are found in the systems from people who experience overdose deaths, we have been seeing an increasing amount of fentanyl present. And so some of those reasons could be is multifactorial. So some of it could be related to the pandemic due to the border closures. So that might have made it more difficult for the drugs to actually come into the country. And so fentanyl is very cheap and easy to make. So and so it made it easier to transport, or there may have been additional labs that were actually started within the U.S. to manufacture the fentanyl.
A lot of dealers cut a lot of these drugs with fentanyl. Jeff, what else can city officials do to reduce the number of overdose deaths in Chicago and Cook County and across the region?
Partner with other organizations. Let's get the word out there. Let's get these fentanyl test strips out there. Let's get this Narcan out there. Let's remove the stigma behind all of it and let people know that it's okay. You're not alone. You're not alone. There's organizations out here that will work with you at any level that you at to help you better yourself.
And certainly overdose, the other epidemic going on alongside COVID-19. Our thanks to Jeff McDaniel and Dr. Wilnese Jasmine. Thanks so much.
Thank you, sir.